Hello and welcome to Selma City Schools Soup Talk, where you can find information relevant to our schools and our district at large. Please welcome our host, Dr. Avis Williams.
Well, greetings, Selma community. I'm Dr. Avis Williams, Superintendent for Selma City Schools.
And I'm Courtney Washington, Community Engagement Specialist for Selma City Schools.
And we're coming to you today for just a special announcement, updates on the coronavirus and how Team Selma is addressing this pandemic that's inciting some concerns within our local community, statewide, nationwide, and beyond.
Right.
And so we want to start off by just sharing the symptoms, and I think most of you are probably aware of it looking like flu-like symptoms to begin with, to include shortness of breath, coughing, slight aches and fever. So initially, we've been told that it does resemble the flu.
Right, but it's not the flu.
It's not the flu. And we do have information on our website, and we're going to share a little bit more about that throughout this update, but with some helpful links. Because we do recommend that you seek professional medical guidance as it relates to this. And this is in no way meant to replace that type of guidance. So the Center for Disease Control is a great resource, and that's also one of the resources that we have listed on our website. But let's talk a little bit about some ways that we can stay safe and healthy and really prevent contracting or spreading the coronavirus.
Right. So, Dr. Williams, you just mentioned that the information is available on our website under Coronavirus Update, and it also has the helpful tips. And our parents and faculty and staff should have received the letter last week.
Yes.
So, included in the letter are prevention tips, which includes, most importantly, to wash your hands as often as possible with soap and water for at least 20 seconds. Now, I've seen where you can sing happy birthday if you don't want to count, but that's a good measure.
I also heard 2 verses of Sweet Home Alabama.
Oh, wow.
Works
That
for
may
that
work
as
too.
well. So maybe you can do that. Entertain yourself as you're washing your hands. But do wash your hands.
As often as possible. And again, the helpful links on there gives you some pictures to show you the best ways to wash your hands. If soap and water is not readily available, then alcohol-based hand sanitizer should be used. It says with at least 60% alcohol.
Okay.
Avoid touching your eyes and mouth and nose with unwashed hands, and avoid close contact with people who are sick or who you may believe are sick, and stay home when you are sick. And you can probably address that for our teachers.
Absolutely, and that's an important factor because we do want you to take care of yourself and your family. We did receive some guidance from Dr. Mackey, our state superintendent. If an employee tests positive of the coronavirus, or if the employee's child or any dependent tests positive, then that employee has to stay home and provide care. And so the expectation is that employee will also stay home for 14 days and should not be charged for sick leave or personal leave. So that's something that's coming down from our State Department of Education. That is very important. But it is important that if someone does test positive, that they self-isolate, which means that they remove themselves from the general population and do so for that entire incubation period, which is 14 days. And that's just the general guidance that's being given, that 14-day incubation period is necessary in the event that someone does contract the coronavirus. And in that case, the employee should take personal leave or sick leave if they are indeed caring for their own personal care. We do want to talk a little bit about some of what we're doing within Selma City Schools to address the coronavirus and to prepare for any incidents that may occur here within our community. As of the recording of this video, there are no known cases of the coronavirus in Alabama. Now, it's expected that will change. When tests begin, it's expected that we will begin to hear of cases. And so what Team Selma is doing is being proactive. On next Friday, which is the day before our spring break, we are going to have a half-day dismissal for our scholars. So scholars will go home at about 11:30 that day. And the purpose of that is for us to do a deep cleaning of all of our facilities so that prior to returning from spring break, buildings will be deep cleaned, and we will, of course, use sanitizer and making sure that we're disinfecting all of our hard surfaces and areas where students and staff work. In addition to that, we are suspending all out-of-state travel until further notice. So any out-of-state travel that's on the books for right now, that's suspended until further notice. And so there's a chance that some of those activities may happen depending on what happens in the coming weeks. But for right now, that includes all field trips, any professional development, as well as sporting activities. So until further notice, we are suspending any out-of-state travel. Also, teachers are going to prepare 2 weeks worth of work, and this will be in the event that we do have to shut school for an extended period of time. We do want learning to continue, and I know our scholars will be excited about doing work if we are at home, but on a serious note, we want to ensure that our scholars still have every opportunity to engage academically and to learn. And so if that has to occur, we will have more information on where those resources will be available and what specific type of resources we'll be providing. And then we're also going to continue to provide updates on our website and our social media outlets. And already we've got the letter that went home last week is posted, as well as a number of important links that can give our community more information.
Yes, correct. That's correct.
And that's my advice to you too, is to look at those links from the Center of Disease Control, the Department of Public Health, and even some of the ones from within state and national government.
Right.
Those will be great resources to stay updated on what's happening in Alabama as well as outside of Alabama.
Yes, it's very important.
Yes. So we also want to make sure that we're we've talked about the practicing the safeguards. I want to make sure we cover all of this because, again, we have spring break coming up next week. And so one other point is if you think you have developed symptoms, you do want to notify your healthcare provider immediately. And at some point, they will have more information about testing. You know, unfortunately, there are some pieces that we don't have a lot of information yet, and primarily because there have not been any known cases in Alabama. But you want to separate yourself from other people and animals within your home, and do not leave your home unless you're going to get medical care. If you experience an urgent health situation, then you should call 911 and inform the medical emergency services that you are self-monitoring for the coronavirus. And if possible, you should restrict travel to a private vehicle or medical transport, which would be an ambulance. And persons who become symptomatic will be required a written physical clearance before they return to work or to school.
And again, just to reiterate those prevention tips, cover your mouth when you cough and sneeze with a tissue or a sleeve, not your hands. I usually tell people to dab and
There you go.
probably hold it there a little bit.
Absolutely.
You can see the CDC Cover Your Cough webpage at on the www.cdc.gov/flu. Provide adequate supplies within easy to reach, including tissues and no-touch trash cans, and routinely clean and disinfect frequently touched surfaces and objects.
Yeah, and those are great tips. If you're at home and become ill, then our expectation is that we get a parent or guardian to come pick you up. And, you know, there's a lot of controversy about the face masks, and the information that we're seeing is that face masks are helpful if you have been infected with the coronavirus, but for others, they're not a prevention mechanism. So the face masks are more to prevent spreading the disease if you already have it. And of course, Courtney has already mentioned washing your hands and not touching your face, and then just avoiding that close contact with someone that you know to be sick. And it's not too late to get the flu vaccine. That's a piece of advice that's been given as well, that the flu vaccine can reduce illness and may be helpful as well. A lot of other helpful tips and advice are within those websites, but I do want to just reiterate what Team Selma is doing, just for clarity. Next Friday will be a half day for deep cleaning, suspending all out-of-state travel until further notice, to include field trips, professional learning, and sporting events. Teachers will prepare 2 weeks worth of work in the event that we do have to have an extended closure, and updates will be posted on our website and all of our social media outlets as they become available. And so please just stay in tune with what's happening as this information becomes more available, and especially as testing begins to happen in Alabama in the event that there are some cases found within Alabama. I think that pretty much covers it. We appreciate you watching. We are available at Selma Schools on social media sites. SelmaCitySchools.org is our website, and feel free to reach out to us if there's anything that we can do to support or to answer any questions that you may have. And so until next time, we look forward to seeing you and hearing from you. Thank you for your understanding, cooperation, patience, cleanliness, and support throughout this entire event. Thank you.